Thank you to the members of the California Alcohol Policy Alliance for the opportunity to be with you. I'm so sorry I was unable to attend last week. I want to extend gratitude and thanks to each of you for your contributions to broader community efforts in slowing the spread of COVID-19. The important work that you're doing to eliminate gaps in health outcomes and connect community members with the critical supports they need is life-saving, and I deeply appreciate all the prevention and advocacy work you lead to educate communities about the harms of substance use, including alcohol, which benefits individuals of all ages. In reflecting on these past weeks, we recognize that public health and equity work continues, and our focus remains on building a just world where everyone has the resources needed to thrive. As COVID-19 cases are on the rise again, we are reminded to do our part and advocate for Black, Latinx, and Pacific Islander communities that remain disproportionately affected. Throughout the pandemic, Black, Latinx, and Pacific Islander communities in LA County saw higher rates of COVID-19 cases, hospitalizations, and sadly deaths in comparison to white and Asian residents. The causes of these inequities are rooted in the very same systematic injustices that fuel higher rates of illness and deaths from other diseases amongst brown and Black people. For COVID-19, protecting low-wage workers, ensuring access to testing and treatment, and creating an economic safety net are paramount to narrowing the gaps. This work is hard and the stakes are high. Many have lost their lives, and those who become stricken can take a long time to recover, often putting their family and their jobs at risk. We do know a lot more about the virus now than we did back in the spring, and we have tools at hand to really reverse the current trends and close the gaps. We will need to prioritize our work and our resources for those hardest hit. The wisdom you bring to our efforts with your experience using a multidisciplinary and intersectional approach that addresses the trauma of structural racism, discrimination, and violence help guide our path forward. I am motivated by the strategies and new plans we are collectively putting in place and looking forward to learning new ways to work together to advance conditions that support optimal health and well-being for all. Thank you very much.